Okay, so we're going to talk about plantar fasciitis, and it's important for you to know that the plantar fascia is a thick band of tissue on the bottom of the foot that connects from your heel bone and goes toward the front part of your foot on the bottom surface. That can get inflamed and irritated, and that leads to a lot of pain, especially when you're getting out of bed in the morning and after you sit down and try to get back up again. There's a few things that we need to do to help you get better. We need to reduce the inflammation levels. We can do that in a variety of ways. A cortisone injection is a real targeted, quick way of trying to reduce inflammation, and we can do that for you today if you'd like. There are some medicines that you give by mouth, like anti-inflammatories, ibuprofen, Aleve, some prescription forms of that as well, or different ones that may help also. You can take that with or without the cortisone injection. There's oral steroids that you take. People that have diabetes, that sometimes can increase the blood sugar, so we want to be careful with diabetic patients with that. There's some topical medications that we can send through compounding pharmacy, and that might help some too with the inflammation. The second thing we want to do is to stretch the plantar fascia and reduce inflammation with icing of the foot. And for the physical therapy type techniques, I'm going to recommend that you do an ice bottle on the bottom part of the your heel. And there's an example right here. If I'm talking to the patient, there's an example right here. I like the idea of somebody sitting down too, of where you do the ice bottle on the bottom part of the foot and kind of roll your heel over that. And you can do that as many times a day as you'd like, but at least a couple times a day would be fine with that. And then there's a stretching technique. If you take a belt or a towel or a TheraBand and put it around the forefoot and then pull back on it, that stretches the Achilles tendon and your plantar fascia. Another one you could do is hold your big toe up, and there's a picture here, and pull it back and just isolate that plantar fascia. You'll feel a real strong pull on the bottom of the foot, and that's going to be good to stretch the plantar fascia. You can do that a few times a day. Another thing you can do to massage the area, which is important, is you can use a tennis ball on the floor, just like you did the water bottle, and kind of roll your heel back and forth on that, and that helps to massage the tissue down there. The last thing I'll show you, I want to demonstrate, is a stretch against the wall. And when we're doing that, I want the patient, you to be at this level with the patient so they're able to look at you from the side, not the back. And you tell them to use the foot that's painful, put that behind, but we don't want to go too far behind, because if you stretch that way, that only stretches the Achilles tendon. We want to tell them to go maybe 2 or 3 feet away from the wall with that heel, leave the heel on the ground, and this one is just to help balance you. And then you'll bend forward and then bend at the knee, keeping the heel on the ground, and holding that stretch for 30 seconds or so, and doing that several sets, and a couple 3 times a day, just to keep the plantar fascia loose. Then we can talk about the night splint, and how when you get out of bed in the morning, you know, when it's real tight, or if you sat a while, watch TV and try to get up, you can use a night splint. And there's a picture of it here, and it helps to hold your foot back so that band of tissue doesn't get real contracted and tight. It relieves some of the pain when you first get going on the foot. Lastly, what we need to do is support the arch of your foot, and we'd recommend the best product is a custom orthotic. That's where we mold your foot or have you walk across a gate plate, and make a product that's specifically for your foot structure. A lot of insurances do cover those. We have a period and arrangement with the company that we use as a trial period. And how that works is we take a $25 deposit, and this will go for everybody besides Medicaid patients, Coventry WellCare. We take a $25 deposit when we do the order of the orthotics. We get them in 2 to 3 weeks, dispense them to you. I'll let you have a month trial period or so, get you back in. We'll know if they're helping you. We'll know if insurance covered them, and then you can make an informed decision you want to keep them. The cost of the orthotics depends on what our contracted rate is with your insurance, so we don't know that right now. Like I said, a lot of insurances do cover them, but at the end of the trial period, you'll know several things. 1, if they're helping you. 2, if insurance covered them, and then you can make an informed decision if you want to keep them. Worst case scenario, if insurance didn't cover them or if they weren't helping you, we could send them back. The $25 deposit you put down goes there toward a return fee to get them back to the company. If they work well for you, insurance covers them, then you can get your $25 back. So that's the best product available. If you don't want to do that, we have Power Steps, and those are out-of-pocket charge. They're $45, and it's a insert that works pretty well. It doesn't last as long as the orthotics, and it's not custom made, but it does a pretty good job for providing for some arch support. So that's the information, and wondering if you have some things that you'd like to do, or what do you have any questions that we can answer for you. So that's number one.